Hello and welcome to the NYRx Clinical Criteria webinar hosted by the NYRx Education and Outreach team. We will begin by defining clinical criteria, also referred to as CC, and is indicated with the red superscript in the preferred drug list or PDL. Clinical criteria, also known as a medical guideline, aims to guide prescription therapy decisions regarding diagnosis, management, and treatment of specific disease states. Clinical criteria is information required to ensure clinically appropriate and medically necessary use of a drug. Clinical criteria requirements are developed by the NYS Drug Utilization Review Board and are based on the drug FDA labeling and generally accepted clinical practice guidelines. Clinical criteria includes, but is not limited to, criteria requirements such as confirmation of diagnosis. To note, NYRx recognizes diagnosis included in a member's Medicaid claim history, but does not recognize a diagnosis added by the pharmacist at the point of sale. Age requirements, review of concurrent medications, disease states, or possible contraindications. Step therapy and frequency, quantity, duration limits are also types of clinical criteria that are discussed in detail in additional webinars. Please note that the claims processing system will review the member's Medicaid claim history to determine if clinical criteria is met. If the required criteria is identified within a member's claim history, the prescriber may not need to initiate a PA. We will now take a look at a couple of examples. In this example, note that all drugs within the movement disorder agents drug class, regardless of preferred or non-preferred status, are subject to clinical criteria requirements notated by the CC red superscript next to the drug class. The user will look at the third column for details regarding the clinical criteria. As noted here, the drug class requires a confirmed diagnosis for an FDA-approved or compendia-supported indication. In this example, note that some drugs within the acne agents topical drug class are also subject to clinical criteria requirements notated by the CC red superscript next to the drug name. The user will look at the third column for details regarding the clinical criteria. For example, tazarotene cream and tretinoin gel, although preferred, do still require a confirmed diagnosis of FDA-approved, compendia-supported, and Medicaid-covered indication. Next, we'll provide some information regarding the NYRxEO team and how to contact us. The purpose and mission of the NYRxEO team is to serve as a liaison between all stakeholders and NYRx to support care coordination. This team assists New York State Department of Health and its stakeholders by ensuring members receive their medications in a timely manner, facilitate intervention and access for medically complex cases, provide detailed information about NYRx drug coverage, prior approval requirements, and NYRx enrolled pharmacies. The ENO team is comprised of clinical liaisons who are trained to support complex pharmacy cases, specifically for members who may have HIV/AIDS, hemophilia, are in foster care, have serious mental illness, substance use disorder, or hepatitis C. The ENO team serves as a resource for NYRx program-related questions and supports New York State by offering educational opportunities such as this webinar. The ENO team hosts virtual drop-in office hours for various audiences throughout the week. These sessions are available to all stakeholders, and we welcome you to hop in, ask a question, and get support when it's convenient for you. Office hours are also available by appointment. If a particular provider or group of stakeholders needs support, this is especially convenient if it requires PHI discussion. For any office hour inquiries, please send an email to NYRxEO@primetherapeutics.com. For more information about the resources and tools that ENO offers, please visit our webpage. This slide contains ENO call center contact information in addition to the ENO website, mailbox, and subscription service. The ENO call center can be reached by calling 1-833-967-7310 Monday through Friday, excluding holidays, from 8 a.m. to 5 p.m. Eastern Time, or by email at NYRxEO@primetherapeutics.com. Please note that if calling to discuss protected health information or PHI in the ENO call center, callers must have an NPI or an individual verification number, which requires a provisioning process to keep member information protected. To find out more about this process or to request an IVN, send an email to the E&O mailbox. NYRx Education and Outreach Notification Service is a new, free service that keeps stakeholders up to date on the latest news for NYRx, the Medicaid pharmacy program. To register, use the QR code in the third box or click Subscribe today. And this concludes the NYRx Clinical Criteria webinar. NYRx Education and Outreach would like to thank you for joining with us today, and we hope that this information was helpful.